But let's have this discussion now. Daily COVID-19 cases appear to be on the decline in South Africa, but a high number of fatalities remain a concern. In fact, 8,988 new infections logged and 555 deaths also reported. All of this in the last 24 hours, while 72,992 lives have now been lost since the start of this pandemic in this country. Meanwhile, just below 8 million vaccine doses have now been administered in a mass rollout program. How should we be reading into these figures? Let's bring in Dr. Mvuyisi Mzukwa, who's the Deputy Chair of the South African Medical Association, joining us now via our video link. Doc, always great to chat to you. Thanks very much indeed for making time. We have been told that deaths traditionally will lag the number of infections we're seeing on a daily basis. With that in mind, should we be, I don't want to say not concerned, but the death toll we're seeing now, is it a matter of great concern to you?
Good morning, Ayanda, and good morning to your viewers. Thanks for having us in your great show. Really, we cannot really say anything much based on just one figure that came out, because remember, we look at an average of about 7 days, what the Medical Research Council call it an epi week, beginning from on a Sunday to Saturday. So I think at the moment we cannot really say that we have a steep rise until we get that average.
And what is that average telling you, at least from the last time you were able to look at that cycle? Are you also getting a sense that the death toll is stubbornly high still?
Yes, if you look at the previous figures, I mean, the average was about 300. I think it was week 29, according to the Medical Research Council. So that's still very high for us in the country. And if the recent figures or yesterday figure is anything to go by, I think we may be having a challenge, in terms of what is happening. Are these deaths happening at home, or are they happening in the hospitals? Or what could be the case?
The NICD, the National Institute for Communicable Diseases, is telling us that, in fact, even as a country, we're not necessarily out the woods, especially once you look at the situation in the Western Cape, for instance. I wonder how much your data is telling you about how far that province is from the worst-case scenario, at least for this third wave.
I mean, the provincial record, and is on record, the provincial health department is on record telling the nation that they are under pressure. And they think that pressure is due to the rise in COVID-19 cases, but also the unbanning of alcohol in that province, in the country as a whole, but obviously affecting the province. I mean, looking at the Western Cape, it has become now an epicenter. If you look at the active cases, still have a very high active cases sitting at around 28,000. And you look followed by KZN and the Northern Province. So it's the possibilities that you could be getting those deaths from those pressured provinces, if I may put it that way.
Yeah. And Doc, what is this moment, or rather, what impact is this moment having on things like elective surgeries? We've heard in the past, for instance, that certain surgeries will be put on hold to try and make space for things like COVID-19 related casualties and for those who need that kind of care. But we also know that many illnesses actually also are time-bound and are time-dependent. In other words, if you don't act quick enough, things like cancers will continue to spread to a point sometimes where you can't even perform surgery on a patient.
Yes, Ayanda, you are on point on that. Many elective cases in the hospitals, both private and public hospitals, have been put on hold because they needed to accommodate for this surge in the cases, and also the occupancy of the health, the ICUs and your high care wards. So that is a huge problem. But also, like you said, the issues like cancer and stuff like that, they can't wait for long. They need to be attended to immediately. But you remember also that other challenges other than COVID-19, like in Charlotte Macracket, there was fire and there was, the whole lot of disturbance in terms of the smooth provision of services, especially as it relates to cancer patients. So that was the challenge there. And not only those things, but also you've got non-communicable diseases like your diabetes and hypertension. And we're seeing lots of those challenges now, where you see patients who are complicating because that has been taken back because, we needed to accommodate this COVID-19 pandemic. So it is a huge challenge that we're facing as a country in both systems, if I may call it so, in the Department of Health.
And are you getting a sense that our system is agile enough to be able to use the window period that comes with a drop in the number of infections, for instance? So we already have in Gauteng a context where perhaps there's an easing of the burden on the system because of COVID-19. Are personnel well positioned to be able to use that opportunity while it still lasts?
Well, as you know, it depends on the planning of the management team. If the management team is not planning, what we have observed is that when the numbers go down, everybody just begin to relax and, no planning in place. You find the people, when there's a surge, they like, waking up from a deep sleep. That's what we've been seeing in most provinces, actually. So I think we do need to have people who are aware that, we're still expecting another wave, the fourth wave. You see, you can't be relaxing now and also giving out messages that makes people drop their guards when it comes to the non-pharmaceutical interventions.
Yeah. In the interim, the other big challenge for our country, at least I believe, is vaccine hesitancy. There's still a considerable amount of people who simply don't want to take the vaccine because they don't trust it. Let's try to address it this way. Of the healthcare workers who have taken a vaccine, who are fully inoculated, how has their response been in the third wave? In other words, how many of them have received severe illness, possible hospitalizations, and maybe even death, at least as far as you know?
According to the Sisonke program, we are told that it's a small proportion of healthcare workers who are vaccinated who got infected or even went to a point of having severe infection. Very few, a very small proportion. So I think we would expect the same trend as we go to the fourth wave, when, as it relates to those who are vaccinated in the population. A trend that is similar to that of healthcare workers.
A sign that the vaccines work.
Yes, according to what we have noted, with the healthcare workers under Sisonke, it shows that it is working, yes.
That in mind, though, do you get a sense that our response to people who are hesitant to take the vaccine is nuanced enough? I mean, there's, I guess, a temptation to completely dismiss the staunch, hard and fastened anti-vaxxers, but there are still many people who genuinely are worried about this vaccine, considering how quickly it came on board and considering how little we still know about COVID-19.
Yes, I fully agree, Ayanda. Actually, a take on this is that it's not only the population that is hesitant. Also, government has been hesitant, because, people want to, have easily access to vaccination, like what we call convenience. The government has been hesitant, vaccinating on weekends, has been hesitant on going to the pensioners. They always wanted people to go to the vaccination sites. I mean, imagine a person going to a hospital. People don't like going to hospitals, and a hospital is not a good place for a vaccination. So they needed to have some sort of innovation in terms of going to the people, also explaining, like you said, people have genuine concerns. There has not been enough information that has gone out in terms of explaining the issues around side effects, and also the issue that people are pointing out that people are dying from the vaccination. Whether that is true or not, you need somebody to come out with evidence, investigate those deaths, and come out in public and explain what happened to those deaths. Are they related to the vaccine or not? So that people are, obviously are put at ease in terms of getting the proper information.
Perhaps don't overlook or brush aside even those deaths from people who are fully inoculated. Loud and clear. I wonder, Doc, whether or not there's anything still to be salvaged? I mean, do you get the impression, for instance, that government is at least learning from what people may consider to be mistakes? And as you answer that, what would the advice be from SAMA to government around how to deal with the issue of perhaps even compelling people to take a vaccine?
Well, I think so far I think government is listening to a certain extent. If you look at the advices that were given in terms of opening up on weekends and also taking the vaccines to the people, I think they are trying their best in that regard. And I think we need to applaud them on that. When it comes to your other concern, I think as the South African Medical Association, we think that we need to identify every stakeholder that can help in the fight against in the vaccination to start with, because this is a prevention. This is prevention. We need to make sure that people are using people that are familiar with. Like, for example, the sidelining of GPs. It's always to us a huge concern that we have people that are known to the communities but that are not being used. And I think government should not just brush aside the private sector and think that they can be able to do it on their own. I understand that they are using some other pharmacists and stuff like that, but it is important that they take everybody on board, especially those that are used to the communities, that are familiar, with the communities.
Dr. Mvuyisi Mzukwa, thanks very much indeed for your time. Great to get your insights on the AM report today. Dr. Mzukwa is the Deputy Chair of the South African Medical Association. Once again, thanks very much indeed.